Hello everyone. My name is Noriko Ninomiya. I'm a doctor who treats female sexual function in Japan. Well, I know it is sudden, but I have a question for you. Are there any women around you who are worried about not able to having sex? If your friend tells that she cannot have sex, how would you advise her? Did you come up with multiple practical solutions to this question? I think you don't have to watch this video anymore, because professional enough. But I think most of you would think this way. You can have sex because you are not used to it. You just have to try again and again. Sex is compatible with a partner, so it's okay if the partner changes.
If you can't insert a penis, you don't have enough patience, so you just have to put up with it for a while.
What a disappointing answer! With such an answer, the treatment doesn't go well. So please watch this video until the end. This time, in this video, I'd like to share my research of treating with a breakthrough vibrator made for women. So first, I will talk about why I decided to use a vibrator to treat a woman with insertion disorder. Many of you know that Japanese people have a sex the least in the world, even though people take it for granted that they can have a good sex. Why do they think that way? The reason? I do want to know. Let's guess their psychology. The act of sex is a natural act, so everyone takes it for granted they can have good sex. If someone finds herself having trouble with sex, she loses her self-confidence. Oh, I am an imperfect person. I don't want to talk such a shame trouble even to my family or friends. I'm bad, and I just have to put up with it. To make matters worse, there are few hospitals specializing in female sexual function in Japan. It is not common for women who cannot have sex to be tested and treated in the hospital. Men's ED can get medicine immediately at the clinic in front of the station. Don't you think this is very, very unfair? Even so, there is salvation. Some hospitals treat women who cannot have sex. Very few. Using a dilator is general treatment for women with sex trouble. A dilator is a device used to split the vagina. Simply put, it's just a thick stick. This means that a patient will get used to inserting. There are other benefits besides getting used to it. Women who cannot have sex are very scared to put something in their vagina. Inserting a dilator allows the patient to understand the structure of the vagina. So, this practice is good for overcoming the fear of sex. But wait a moment, this treatment has a big problem. In this treatment, a patient needs to insert a dilator by herself. She needs to practice independently. Therefore, it is difficult to continue if the patient is not happy. Imagine a woman who doesn't like sex uses a dilator. It seems that she doesn't have fun. How can you make their practice fun? I thought carefree. How about cute? If the equipment patient used for practice is cute and pleasing, that will make their practice more enjoyable. So, I came up with the idea of using a vibrator instead of a dilator. But I hit the wall. Ouch! There was a big problem. Ordinary vibrator are not cute. All products have an erotic look because it is made from a male perspective. Unfortunately, I thought that this type of thing could not be used for practice female patients who are not good at sex. Many patients will find it embarrassing to leave it at home. When practicing, they might feel uncomfortable. Are there good products? That's it. I got an answer. Yes, I remembered Tenga's Iroha Fit. It's cute. I decided to use this for patient practice. So this time, I tried to use Iroha Fit instead of a dilator for patients with insertion disorders. You are waiting for the Iroha Fit info, aren't you? I'd like to introduce Iroha Fit. There are some differences between Iroha Fit and other vibrators. Here are 3 of my favorites. The first good point is its appearance. In a word, it's cute. This is the color that women like. It's not flashy. It's a soft color. The curves are not excessive. Simple and elegant. At first glance, some people may not think it's a product for sex. The second good point is the texture. It's very smooth and softness. It's also good that we don't feel cold when we touch it. Iroha Fit has a texture similar to human skin and gives patients a peace of mind. Moreover, it is waterproof. You can use it anywhere. It is also hygienic because it can be washed cleanly after using. The last good point is that it blends into daily life. Charging is required to move the vibrator. Iroha Fit can be charged by storing it in a special black box. Even if it's next to the desk, everyone doesn't feel strange, right? Iroha Fit has a lot of ingenuity to prevent sex from being extraordinary. You want to know how to use it? Understood. I will also introduce how to use it. It's very easy to use. There are only 2 buttons. All operations are possible with large and small buttons, like this. Anyone can operate it. Now, all you know the good point of Iroha Fit. Well, finally, I'd like to share my research. This time, I investigated the effectiveness of Iroha Fit for an insertion disorder. Participant. The condition of the woman surveyed are 20 years old and over, no pregnancy history, under treatment for insertion disorder. In this study, menopausal women are excluded in the survey. Patients who agreed to participate in the study were first given an explanation of the structure of the vagina. They were handled over Iroha Fit and the recording papers called Iroha Diary. They were instructed to practice once or more per week. In the Iroha Diary, there are articles posted how to use Iroha, how to practice step by step, and questioned to record in symptoms. The practice period was 3 months. Result. Next, I would like to talk about the result of the survey. 14 patients participated. The average was 29.9, with the youngest being 24 and oldest being 44. 7 were married and 7 were unmarried. About a history of treatment for dyspareunia, all 14 were moisturizing the vaginal area and treating with topical hormone treatment. 3 had a history of CO2 fractional laser treatment in the vulva. Result of practice situation. The average practice status was 1.07 times per week. The reason why they couldn't practice as planned, the number 1 is during menstruation. Second, they didn't have time. And third, they didn't feel like it. Impression of using Iroha Fit. Next is about the changes after using Iroha Fit. 12 people answered that Iroha Fit is easy to use. 11 responded that Iroha's practice made them more positive in sex practice. 12 responded that they could understand the pleasure by using Iroha Fit. The 2 replied that Iroha Fit made it easier to get wet. Moreover, 2 out of 14 responded that the pain of insertion was significantly improved. No one had worsened the pain. Next is about the result of which was better, Iroha Fit or dilator. The result was shown this slide. Iroha Fit was superior in terms of friendliness, usability, and motivation. There is no differences in fear, safety, or embarrassment. The cleanliness was better with the dilator. Finally, the 14 women who participated in the study investigated what they consider important to their treatment. Here is the result. The most popular thing was that it was easy to practice. It's about 90%. The second popular thing was to get better quickly. The patient want to solve their sex problems in a hurry. It may be because the problem of sex is not just their own problem. The third popular thing was no pain treatment. Many of them are unable to insert a penis because of pain. So it's very convincing that no pain treatment is important. But in fact, I'm surprised at this result. I had thought no pain was the most important thing for them. But they answered, easy treatment was much more important than no pain. Even more surprising was that they think safety and price are not so important. The women who participated in this search are young. We couldn't say they could afford it. However, the demand of price turned out not to be high. How did you feel about these results? That's all about my research about Iroha Fit. Iroha Fit is effective as an alternative treatment to dilator for women with insertion disorders. Well, that's all for my story. I'll be grateful if you could find useful information. Thank you for watching until the end. Please continue to enjoy the conference.